I'm Susan Johnson, and I'm the Director of Brain Injury Services at Shepherd Center. And Shepherd Center is in Atlanta, Georgia. We're a 152-bed hospital that serves people with brain injuries, spinal cord injuries, and MS. We have a full continuum of services that from ICU all the way through to post-acute services. So I'm here at this meeting today as a representative of Shepherd Center for the Model Systems program. We are not a Model Systems, but used to be, but we're fortunate to be still a part of the program. It's really been incredible. This is my first year. My staff have come the last 4 or 5 years and have actually convinced me to come and said that there's a lot of good information from a program standpoint, a lot of good collaboration, and what's been really beneficial in this is to see the networking and the collaboration and work that we all can do as a group to really become more efficient in our healthcare needs. I've been doing rehabilitation and brain injury for about 35 years now, and I remember when it used to be more of like everybody was very territorial about what they did because they needed the referrals and felt that they were the best. But now we all are really geared much more towards meeting the needs of patients and families and really collaborating on better efficiencies and support for folks to get the care, because obviously I call it erosion of healthcare. I think there's some good things that have happened in healthcare, but rehabilitation has been an area that I think has eroded in how folks can really live quality of lives. I think there's a lot of good technology that's there, but I do think that in getting and meeting those needs is really sometimes a problem. Changes in healthcare reform, I think that rehabilitation is going to be strongly affected, and we as professionals are going to have to figure out better efficiencies and better support for folks, because I do think that the focus is going to be more on wellness and prevention. And so how do we educate families and patients on, number one, how to prevent, but then number two, how to stay healthy, but then number three, how do we help in the interim to support optimal recovery so folks can live quality of lives. And we've seen that in rehabilitation, especially in TBI rehabilitation. So we are going to have to figure out, and I think this particular meeting has really helped us to look at what sort of social media kind of things can we do. How do we better educate our patients and families to access resources that might not necessarily be available to them through healthcare insurance, but give them the opportunities to understand how to still continue to recover, because people with brain injuries can get better for 10, 15 years, and so how do we access those resources at that timing as we begin to see healthcare change so drastically. So far what I've learned here, I think the networking is the best part. I also think that some of the efficiency that we just talked about a few minutes ago, I think are real critical, and seen some really innovative practices that we can bring to our organization. The cool part is I see that we're doing a lot of the same kinds of things. We may have good pockets of certain things, but to bridge it all, I think it's going to be critical for us in the next year to 2 years to really look at better standardization of our practices, to really optimize that in whatever part of the country you're in, and begin to share some of that so that we can allow folks to live quality of life. So I think that's going to be a really critical factor, and I think that's what this kind of group can really do, is begin to look at best practice, look at the evidence, and really work together in standardizing practices so we can meet the needs of people with brain injuries.